Like I said, Tony first, Dave second. What am I raising? Oh, sure.
Much better, right, Christine? You can hear me much better? Okay, so I think we can get started. I know it's Monday morning, the week before Christmas, the week before, and the opening of Hanukkah. So, yeah, so, okay, awesome. All right. Good morning. I'm Debbie Penton, President and CEO of Outreach. On behalf of the Board of Directors, the staff, and I do want to say, especially the staff that has worked day in and night out on this project and has really poured their souls into this project, and all the individuals that we serve, it is my great honor to welcome you to the ribbon cutting ceremony for the Outreach Center's new integrated opioid treatment program, also known as OTP. 40 years ago, Outreach was founded with one very important goal, and that was to help and build healthy lives. Our mission is to inspire individuals and families to achieve a life of unlimited potential by developing and delivering the highest quality of services based on behavioral health services and training. Since 1979, we've expanded our reach to include a multitude of programs to meet the needs of the community. The new integrated OTP is another important program to help us assist individuals on their journey towards recovery. As you may know, the opioid epidemic on Long Island continues to rage on, unfortunately. Suffolk County has the 7th highest rate of overdose deaths in all of New York State. Over the last decade, fatal overdoses in this country have nearly tripled from 13% to more than 30% per 100,000 people. The impact of this crisis on individuals and their families and the community overall is devastating. I am so pleased, though, that Outreach with this new integrated OTP can play an even greater role in providing life-saving cure in Suffolk County for individuals suffering from opioid use disorders and their families. The OTP will offer methadone maintenance treatment, which, according to the U.S. Center for Disease Control and Prevention, is the safest and most effective form of opioid addiction treatment currently available. Additionally, led by our expert clinical staff and its director, Tom Olivier, the OTP will provide several other functions, including assessments, clinical counseling, utilizing our signature trauma-informed, person-centered care approach, psychiatric evaluations, peer services, case management, vocational assessment, and last but not least, counseling. The goal of this integrated approach is to serve the whole person and support them fully throughout their recovery journey. Of course, this OTP and all the work we do here in Suffolk County would not be possible without the guidance and support of many important and committed people in this room. And when I say that, it goes from providers to colleagues to state government to the local LGU, and everyone has been extremely supportive. I am thrilled that we have a few other dedicated individuals with us today who help Outreach realize this innovative program that would save lives. Our first speaker has been instrumental in bringing us all here today and to mark this special occasion. It is my honor to introduce Commissioner Dr. Shanaza Cunningham of the Office of Addiction Services and Support, affectionately called OASAS, with whom none of this would be possible. Dr. Cunningham is a physician, a researcher, a public health professional who brings over 20 years of expertise in substance abuse treatment to OASAS. She knows her stuff. She knows this stuff firsthand, how important it is to provide access to life-saving medication-assisted treatment. I cannot thank her enough for her leadership and support in establishing this new OTP. Please join me in welcoming Dr. Cunningham.
Thank you so much, Debbie. So thank you to Debbie and to the Outreach Development Corporation Board of Directors and staff for inviting me to participate here today. I want to acknowledge Assemblymember Brown and all of his support for the work that we do here. I also want to acknowledge Carrie, who is really one of the most fantastic directors of community services in the state, and I'm not just saying that. And the Islip Town Supervisor, Angie Carpenter, for all their support. So I'm really excited to be here for the ribbon cutting of the Integrated Opioid Treatment Program, or OTP. It's the first integrated OTP for Outreach and the second comprehensive integrated OTP on Long Island. And we know that these services are critical, especially when we are experiencing the worst overdose epidemic ever on record. And as Debbie had mentioned, certainly Long Island is experiencing a lot of the challenges with overdose deaths. Just in last year, Long Island had 713 people die of overdose death. 713 people who were mothers, fathers, daughters, sons, neighbors, coworkers. So, this community, I know I don't need to tell you, is really strongly affected by this overdose epidemic and makes these services even that much more important and critical as they are truly life-saving services and using a data-driven approach. Since arriving at OASAS a year ago as commissioner, my vision is really embracing harm reduction by helping to keep people alive, using an evidence-based, data-driven approach, and really embracing equity. And so this program, Comprehensive Integrated Opioid Treatment Program using methadone, is one of the gold standard ways of evidence-based treatment. We know that methadone treatment reduces mortality by 50%. So it cuts the risk of overdose in half. And I can tell you as a physician, there's really very little that we do in medicine that has that kind of effectiveness. So it is truly, truly life-saving. In addition, around equity, it's absolutely important to remove barriers to treatment regardless of race, gender identity, economic status, or geographic location. And so making sure that Long Island has effective treatment is absolutely part of ensuring equity. As if things aren't bad enough, we know that the COVID-19 pandemic also made everything worse, including overdose death rates. And so again, really speaking to just how critical it is that these services are here. So I'm pleased as a representative of OASAS, that we have awarded nearly $3.5 million across the state for services like this, and we've awarded over $200,000 to outreach to really support the work with their integrated opioid treatment program. So thank you, Outreach, for your long-standing and deep and unwavering commitment to serving people with addiction. And thank you again for inviting me and other OASAS staff to be here today to celebrate this opening. Congratulations to Outreach and all the staff. We know that your work here is going to save lives. Thank you.
Thank you, Commissioner, for all of your support and your leadership. We look forward to the ongoing partnership. So as we continue to welcome our friends to join us, there's a special person here. The next speaker I would like to invite up. Folks know that in the time that I've been in the field, I did most of my work outside of Long Island, so Long Island is relatively new for me. But I think I'm learning a lot, and I'm learning fast. And one of the periods of which I think I learned fast was when I went to visit Assemblymember Brown in his office. And it was really an opportunity for me to sit and chat with you and understand your long-standing passion for this work and for Long Island. So it is my honor to welcome another great champion to Outreach and the surrounding communities, the Honorable Keith Brown, New York State Assembly Member for District 12, which is comprised of both Suffolk County, including the towns of Huntington, Babylon, and Islip. Welcome.
Thank you for that warm introduction. So today is a great day in the fight against overdoses, and today is a great day for Outreach Long Island. I am really so happy to be here. All too often lately we just hear of the devastating problems and how hard it is to get treatment and all the things that go into that. So today, we're actually talking on the positive side. So everybody should be smiling and happy because this is amazing what's going on, right? We collectively have joined together to fight this horrible epidemic that we have going on. So Deborah and I sat down, as she said, in my office down in Northport. By the way, I've since moved. I'm in Comac now, so I'm even closer to you. But I'm happy to be the assemblyman from this area. This is right in the heart of my district, but more importantly, I'm the ranker of the Assembly Committee on Alcoholism and Substance Abuse. I'd like to thank everyone for coming today, including New York State Office of Addiction Services and Supports Commissioner Cunningham, who, when you said those remarks, I was thinking to myself that you have this amazing resume, but her and I hit it off because at the end of the day, she's a mom also. And as a dad of 3, and as some of you may know, I lost my nephew, Jesse Romanowski, 4 years ago to an overdose. And whenever I think of the work that I do, I always think of Jesse, and when I told Commissioner Cunningham that, she said, well, I'm a mom too. So, we all share in that, that we're trying to not just protect our own children, but we're trying to protect other people's children and other young adults. So, I also want to thank Harry Bessman, the Director of Suffolk County Department of Health Services, Division of Mental Hygiene. I can tell you that your office does an amazing job, as I personally experience, The people that are at the end of that phone do wonderful work and really help get the information out there. And I'd also like to thank my friend Supervisor Angie Carpenter for being here today and her support of this institution in Outreach, Long Island. As you know, Outreach has a lot of good things going on. Recently, we were at the groundbreaking for the new inpatient facility right on Crooked Hill Road, which is amazing because it's only the second inpatient facility here on Long Island, a population of 3 million people, and we finally got beds on Long Island where people don't have to go to Connecticut and Florida and Michigan and California to receive inpatient treatment. So I look at that as a huge step right there. So, but the reason why we're here today is to celebrate the new expansion for Outreach Long Island at the opioid treatment program, which is offering new services specifically for those suffering from opioid abuse and addiction. As the New York State Assemblyman, I have made it one of my top priorities in office to combat the epidemic of drug addiction to our nation, to our state, to our county, and our communities that they're facing. And to hear the 713 lives that were lost, you know, I just always come back and say, you know, where is the public health crisis? Where is the, emergency action by the governor? And I say that with all due respect, right? Because we know we had a public health crisis with COVID, but before that, we all know in this room that we had a public health crisis with addiction. And it hasn't gotten any better, in fact, it's gotten worse. So, I ask the governor to please, now, we know that COVID has not gone completely away, as my sister-in-law just came down with it last night, the second time in 2 weeks. But at least it's not as life-threatening as it was at one point in time. But we know that addiction is, right? To hear the 50% statistic is amazing, right? Because that's really truly making a difference and making sure that people are able to sustain themselves and live long enough to hopefully get the treatment they need and turn their lives around. So I could not be happier than to be here today, and I want to commend Outreach for their continuous work, the tremendous work they're doing helping people with substance abuse as well as co-occurring disorders. I cannot stress the importance of the work done here and how this program is a tremendous stepping stone for drug treatment and rehab. My work with Deborah, with Christine Cassiano, and with John Vincent, my dear friend back there, we, collectively, we started something called the Long Island Drug Coalition. And first it started with about 20 people from different programs across Long Island. It spread into Nassau County with Renee, and then it spread into the boroughs, and now it's statewide because we have some good contacts up there. One of the things that we're working on is co-occurring disorders and integrated care. And last year in May, we had a full-day seminar where we gave out continuing education credits to, I think we had about 200 attendees at that, out in Wellbridge. And we're planning on doing it again this year in April. And we just are in the process of forming a working group for that committee. So if you're interested, please see myself or John Venza after the program. But I'm going to put you on the spot, Dr. Cunningham, because I just reminded her, I had asked her if she would be the keynote speaker along with Dr. Sullivan from OMH, because last year we had both deputy commissioners there, and it'd be really wonderful to have the two of you there. Because at the end of the day, having integrated care, we know that the world doesn't work in silos. Yet government for years always liked to put people into silos. And life just doesn't work like that. So integrated care, the combination of OMH with OASAS, is so important that it would allow us to make sure that there is no wrong door, right? It's not one or the other, it's combined, right? And it's making sure at the end of the day that we're providing the services that people really need. So I look forward to working with the committee that we had last year and expanding it and having you come out to Long Island again. We'll do it this time at maybe the Crest Hollow or the Marriott, so it's not as far for you to drive out to Calverton. So getting back to today, the opening of the opioid treatment program on the grounds here at Pilgrim Psychiatric Center marks an even closer relationship between our state and county agencies. It's important for organizations like Outreach, OASAS, and OMH to all be on the same page when facing the same crisis. The center will operate 6 days a week and ensure that individuals have access to the support they need. It's one of only a few of its kind in Suffolk County, and its functions will include assessments, methadone maintenance, clinical counseling, utilizing a trauma-informed, compassionate, person-centered approach, as well as psychiatric evaluations, peer support, case management, and vocational assessments and counseling. I will continue to support the mission of Outreach Long Island every way I can. I wake up every day and say to myself, we can't do enough to deal with this crisis that we have. And we want to help one another achieve the same goal, which is helping people we love overcome their struggles and change their lives for the better. Thank you very much, and God bless.
Have a little shorter. Good. Great. Thank you, Assembly. We really do enjoy working here. Thank you for all your support. So our next speaker, and someone asked me on an interview, I think it was last week, when did we start this project? And actually, right, Christine? I think it's in the same room.
Yeah.
We started the dialogue about this project, and it was 2019. It was before, just a couple, like in the summer, before COVID started in 20. And when we decided to do this in 2019, the first person we reached out to was Carrie Faith Besson. And I have to tell you, when we sat and we met with you, and you gave us the insight that you provided for us, and at least for Christine and I, when we brought it back to the team. And I had the perspective from a New York City perspective, working within methadone services, but I didn't have a Long Island perspective. And when you shared that perspective with us, we came back here, and the management and the staff said this was a project we wanted to do. And we could not have done this without you. So please join me in welcoming Carrie Faith Besson, the Suffolk County Director of Mental Health and Hygiene. Thank you so much.
Good morning, family.
Good morning.
Good morning, Carrie. Thanks for having me here. I am Carrie Faith Besserman, as I've noticed from the big sign that was on my chair. So thank you for that. I am the Director for the Division of Community Mental Hygiene and part of Department of Health for Suffolk County. And I am beyond pleased to be here today. I wrote really tiny words and did not wear glasses because I know I never really read what I write anyway. But what I do want to say is thank you so much. And I believe you're giving me way too much credit. It's really the work of everybody behind the scenes who wants to do this. I'm not really a good speech person because I'd rather do the work than talk about the work. The team here at Outreach has done a lot of work. I mean, we've had multiple conversations, we've had field trips, we've had revisions, we've had discussions, I've had referrals. It's amazing. But the thing is, we need this in Suffolk County. So as my responsibility in LGU is to encourage people and to help us do this because we need to save lives. That's it, period. It's not that big a thing. It's not about, prowess. It's not about, ooh, look what we did. It's about people's lives. Methadone saves lives. And it's ironic because Suffolk County has run the 4 clinics the longest, and most other counties don't even have their own clinics. We've been doing it for years and years and years. And the stigma attached to that was terrible, and we're breaking it. Things like this takes away those barriers. Stigma is killing people, so stop it. It's just that simple. If you can go into a program and get whatever service you need, whenever you need it, you're going to get healthier. And as you are able to access care, Even if you're not ready, but you know it's there, there might be a time when you are ready, or your family is ready, or somebody else you know is ready, or somebody's educated enough to have that tough conversation with you when the time is needed. That's why we need programs like this. And it shouldn't only be, and I told you this, it should only be on the counties, right? It really is about the people, because you want to have options. This is an option we haven't had before. There's flexibility, there's ownership, there's self-direction. That's what recovery is about. So I wrote on my paper something really nice, and I'll read it now because it's probably better for the snippets, but my heart is what I'm telling you, is that it's about saving lives. So I thank you again for inviting me to share this day with you, because today we celebrate the outcome of a lot of effort by many people, and creating new services is truly a team effort, but mostly we celebrate the individuals who will come to this program. We celebrate their bravery, their vulnerability, and their resilience. So on behalf of Suffolk County, we thank Outreach for providing expanded service opportunity to increase access to methadone. It's imperative that we continue to challenge the stigma of the past, recognize that medication has a role in recovery plans. To do this, we must make the medications, all of them, increasingly accessible to those who may benefit from them. Today, we celebrate that increased access. Today, we celebrate potential, and most importantly, today we celebrate life. Thank you.
Great, thank you, Carrie. I'm very happy now to introduce Outreach longtime friend and community leader, Islip's Town Supervisory, Angie Carpenter. Angie, we are so honored to have you with us here. Like all the other speakers today, you are a member of our Outreach family, and someone to whom we are very grateful for your loyal help and support. Angie is a public servant who impacts resonates well beyond her role as Islip Town Supervisor. She's a great friend and a connector, and we are deeply grateful for her ongoing partnership. Thank you so much, Angie, for being here.
Thank you, Debbie. It really is an honor to be here today and help celebrate this incredible achievement. Listening to everyone speak, and I apologize for being late, I kind of got lost in the maze. I was looking for the signs. But so I hear some giggles out there, so I'm not the only one, right? This truly is a wonderful achievement, and the whole idea of it being an integrated approach, I think, is truly the key to success. And integration and cooperation and partnerships from all levels of government are truly what is needed. We in the town don't have delivery of services. However, when I became the supervisor, and it was obvious that there was a need, we established an opioid task force and at least bring people together and try to help connect. So that idea of being a connector, I take as a sense of pride. So with that, I want to thank our partners in the state and the county, and especially to the Assemblyman, Assemblyman Keith Brown, who you could tell from his words today has a passion and a dedication, and that is so sorely needed in government and certainly within the need of this community. So I'm proud that you're in the town of Islip and you do have a partner, and whatever we can do to assist, we plan to do that. And I have a certificate here to commemorate today's ribbon cutting, and look forward to hearing many, many success stories of lives saved. And this is such a fitting time of the year to be embarking on this new achievement of outreach. We're in the holiday season where we're celebrating Christmas and Hanukkah. I was at a Hanukkah celebration last night as they lit the first candle and spoke about faith. And with faith comes hope, and that's what outreach is all about, giving people that hope. There is hope for recovery. There is hope for success. And I want to really congratulate, and from the bottom of my heart, thank everyone in outreach for the good work that they do each and every day and for the lives saved. Thank you.
Thank you, Angie, for this and for all that you do. You acknowledging the work that we do means a lot to us. So we are in Suffolk County, and this clinic, this integrated clinic will be open here in Suffolk County, but we also have a very close relationship with our Nassau County partners. So I would like you to join me in welcoming Barry Rominsky. Barry is the Assistant to the Commissioner of Human Services for Chemical Dependency in Nassau County and has taken the time out of his busy schedule to join us. We are honored to have you here. Please welcome Barry.
Thank you, Debbie. It is Monday morning. We've already heard words of inspiration from Commissioner Cunningham and from our government, so it is a great way to start Monday morning. Thank you. It's my privilege to be here representing County Executive Blakeman, who honors the words of the Commissioner. This is a big place, Long Island, millions of people. And Nassau County is so grateful to Outreach for the opening of our OTP program here, integrated OTP, and the ability to access greater care for our residents in Nassau County. So it really is a privilege to present a citation to Outreach, acknowledging the effort and the work that went into providing this. I won't bother reading it, but I hope it hangs somewhere in the program. As a side note, I do want to add, after 40 years plus as an executive director of a community-based agency, this isn't my first visit to Outreach. I've long been involved with Outreach in your Roosevelt project and in sending family, friends, neighbors, and relatives to your adolescent treatment program. So it really is a privilege to be here in person again to participate in this great opening of the clinic. And as a final note, I know you've referred to this as a project, but I also know through my work with you over the last year, it's not a project. It's the sacred responsibility that everyone in this room participates in. So I thank you, thank your staff for all of these decades of support for our services in Nassau County. Thank you, Deb.
I received this really on behalf of my staff who's standing in the back there. They've worked so hard on this project, and but on bringing this to fruition, it's really a great day for us here. I think we have come to the end of our formal piece. I want to thank all of you for joining us here today as we cut the ribbon on another vital outreach program here on Long Island, and that is the integrated clinic for methadone services that also is part of our outpatient program. We are committed to walking the talk and providing through direct action that we are devoting to building healthy lives within this community. Thank you again, Dr. Cunningham, Assemblymember Brown, Carrie Faith Besseman, Supervisor Carpenter, and Barry Walensky. You have all made this event a day to remember in Outreach's history. And again, this just brings me great joy. I've been in this field for a very long time, over 25 years, and I have to tell you, running a methadone clinic is one of the latter things I did in my career. In terms of the earlier part, was mostly residential and outpatient work that did not include methadone services. And I have to tell you, my perspective on addiction treatment significant change when I had the ability. VIP is here, actually, when I worked at VIP and had the opportunity to really manage that program. It's a difference. It makes a difference. And I do want to thank everyone for being here. And I'm so happy that we would launch this program on January 4th. Officially, our first patients will join us at that time. Right now, if you can join us outside for the room. Thank you.
I like it.